Hello everyone, I'm Dr. Swati Bisht. I stay here in the city of Bangalore with my family, my husband and 2 kids. So I'm an anesthesiologist basically, and I can tell you being one is a very challenging job I face every day. I was looking for something more to expand my horizon or get more opportunities in the healthcare domain, and we were looking for the best and the top university in India, and definitely BITS ranks amongst the top, and then that is how I enrolled in the course of MBA Hospital and Health System Management BITS Pilani. It was a very great experience learning new concepts, the latest happening in the health industry. I would appreciate the design of the program, which enabled us, the students, to take part in the live lectures happening during the weekends. And in these classes, we could ask the real time, the doubts we had. Whatever doubts we had, everything was cleared by the professors. And suppose we could not attend these live lectures because of our tight schedule, weekends also we would have hospital duties. The program enabled us to go through the recorded lectures later when we had time. We had an amazing set of faculty who taught us. I would like to especially thank Professor Sandeep Kayastha, Professor Nivedita Sinha, Professor Raghunathan, Professor Rajiv Gupta, Professor Ankita Nagpal, and of course our Professor P.B. Venkatraman, sir. I would like to mention here that one semester, the final semester, was held by the Christian Medical College, Vellore, in which they taught us various subjects like strategic management in healthcare, hospital operation management, disaster management and epidemiology, along with biostatistics. A special mention I would like to say is about the disaster management Professor Ravi Samuel, who taught us beautifully about the disasters happening and how the hospitals are affected, and how, like today in the present era, we see so many fire disasters happening around, electrical, be it cyber attack, and sir taught us everything as hospital management people, what all we should know, how to avoid this and how to deal with the, even the present biohazard that we had 2 years ago. The first 2 semesters held by BITS Pilani had created a very strong foundation on statistics part and the lean efficiency part, and it helped me to do the dissertation in the final year, how to bring about an improvement in the operation theatre, how to increase the efficiency and productivity in my operation theatre. And during this dissertation, Professor Rajiv Gupta mentored me a lot. He helped me how to apply the Lean Six Sigma applications in improving the operation theatre efficiency. I would say after taking this MBA in Hospital Health System Management program, it has broadened my vision. I stepped out of my anesthesiology subject and started looking at the healthcare domain in totally. I wanted to bring about an improvement, how to deliver better healthcare to the masses in general. To sum it up, I would like to say that this program is ideal for doctors who would want to step up and go into the field of administration and bringing about good management changes in the hospital and providing a good healthcare provision for the masses. Definitely, the advantage of this program was that it helped us, it enabled us to continue studies, get into further learning without taking a career break.